Hi, and welcome back to the Dr. Ramsey Show. Today I have a very special guest with me for many reasons. What we're going to talk about is 2 weeks ago with the weight loss program, I had showed you what inflammation does. It causes plaque to adhere to our vessel wall. And we were talking about how food is so important to prevent inflammation and certain drugs to avoid to prevent inflammation. So who I have with me is a very long-term patient, very dear person. She's got one of the best outlooks on life that I've ever met in my life. And I think that's a big part of her health and success with her health. But she's here today. Sharon is here today. Welcome.
Thank you.
To the Dr. Ramsey Show.
Thank you, Dr.
So nice to have you.
Can I call you Teresa or Dr.
Teresa.
Ramsey?
Teresa.
I've known her for so long.
Yeah.
I call her Teresa.
Yeah. I introduce myself to new patients as Dr. Ramsey, and then I say, you can call me Teresa. So, Sharon, you've been a patient, gosh, almost since I started practice in 1996. And what we're going to expose today is how well oral estradiol prevents plaque from accumulating in our vessel walls. It's such a big deal to me. That's a really big take home is we can prevent heart disease by taking oral estrogen. Oral estradiol is what I'm going to say. And you and your boyfriend, Gary, both did a test called the calcium score, which tells me about the plaque in the heart vessels. And you've been on oral estradiol for all these years, not on a statin. Some people wanted to put you on statins for your cholesterol. And how much plaque did you have in your heart?
I didn't have any. I was amazed.
That's
yes.
what oral estradiol does.
Yes.
It's so beautiful.
Yes.
And here your same aged partner who's been on a statin for
20 years, he said. Yes.
20 years, had a lot of plaque in his vessel walls. It was like 1700, 1690.
Yeah.
And so it goes to show you that the best statin in the world is oral estradiol for both men and for women to prevent plaque and to get rid of it. Like we didn't do a baseline to see if you had it.
Right.
But doing a baseline shows you that after 2 years of oral estradiol, if that plaque is soft, it is gone. It is such a beautiful thing.
Right.
And here you are. And so Sharon has such a good outlook on life. You always have. You've always been dancing, smiling, looking for the bright side of life all the time.
Thank you.
And to me, the heart's about, heart health. Heart is about the energy is between joy and lack of joy. I've never seen you not have joy. And I think that's a big part of it too, not just the estradiol.
Yes.
You eat well. I remember with Sharon, we struggled with all the fruit you like.
Yes.
Because it was preventing your A1C from dropping down.
Right. I like sweets. Yes.
You do, but you do well with them.
Yes.
They don't take over you. You have a relationship where.
Long time ago, you recommended the Atkins diet,
Yes.
which I used for a while, but I went back again to low fat, and I struggled with weight all my life, and now I'm pretty much on the keto plan.
Yes.
Which is very much Atkins, and I don't have sugar cravings anymore.
Exactly. When you eat the right way for a certain amount of time, those cravings go away.
I know. I'm back to eating like my parents did on the farm in Nebraska.
That's right.
Fat, meat, and bacon, eggs.
And we don't have to eat a low-fat diet to not have plaque in our vessels, right?
Yeah.
We don't have to low-fat diet to lose weight. We lose weight with real fat. Fat burns fat.
Yes, to have energy.
Right. And so, like you're saying, you have sugar cravings and the fat, but it's not attaching to your vessel walls. And that's what today is all about.
Right.
Yeah. Was Gary upset like that you didn't have plaque and he did?
No, he was really impressed. He's very impressed with your practice.
Well, he's used to the VA.
Yes, and he wants to be healthy, and he wants to be happy, and he was really amazed at just coming to you 2 or 3 times. Yeah. Yeah.
It's a totally different experience.
Yes.
We go beyond tools that we're supposed to use, meaning the VA uses only what's approved for certain things.
Right.
They won't give testosterone. They won't give estradiol to get rid of plaque or prevent it.
Yes.
And he has no side effects taking estradiol. Like his no breast tenderness, which is what men worry about. If I take estrogen, am I going to grow man boobs? And the answer is yes, if you're on a commercial testosterone from CVS or Walgreens, because those are my female doses, it's not enough to get rid of that. A man's dose of testosterone burns subcutaneous fat, which is breast tissue. And so when I give them estradiol on top of it, for either their prostate or their vessels or their memory. They never feel it. It's a silent protector. In 2 years, we're going to look at his calcium score.
Yes.
And it should be 0.
Yes. We're excited about that.
Me too.
Yes.
Me too.
We have a project, our health.
Yes. Yes. And you guys dance together, right?
Yes, he's taking dance lessons with me. I met him online, and I said I'm taking, and he agreed to take dance lessons, and so we love it. Yes.
So you're doing it online? Did you say?
Yes, we did. I met him on the online dating online service.
Didn't know that.
Yes, and
So fun.
and we're both 85 years old, and he was married for 62 years, very loyal person, and I'm also a widow, and we're just having lots of fun. Yes.
See, there is life after loss.
Yes, and he is so willing to tend to his health.
And that's big for a man.
Which is something, which is something that I was really adamant about,
I know that, right? You want someone to have the same value systems that you have.
Yes, in the same value system, and we're just having a lot of fun.
I know. I can tell. You brought a lot of joy into his life that he didn't even know existed.
Yes.
So it's nice to see his eyes open and
yes, and
get
that he's willing to pursue the extra effort and money it takes to go into natural health.
right.
Yeah.
But he's already seen some benefits.
Yes, he has.
So, and it's not been that long that he's been a patient.
Right.
So that's what it doesn't take much when you give hormones. It doesn't take much to feel and function better because it's just what we can't make anymore. And people fear estradiol because they fear breast cancer. Women don't die of breast cancer; they die of something else. And women who take estradiol, Sharon, I know you know this, have a lower risk of breast cancer than women who don't take it because the hormones keep our cells healthy.
Right.
And I don't see these long-term risks in my patients like breast cancer, heart disease. I don't see it because of what we give.
Yeah.
Do I see it sometimes? Yes. One of my long-term patients was just diagnosed with breast cancer. We can't prevent all, but we prevent a lot.
Right. And whenever I'm prescribed medicine, I talk to you first before I take it. And you always give me an alternative. Usually that's better.
Right.
And some of my health practitioners are very happy too that I'm using proactive health instead of reactive, yes.
Exactly. We don't want to have a heart attack and then clean up after that. We want to prevent it.
Right.
Yeah. But thank you. I really am grateful you came because I think this is such a big topic for me as preventing heart disease, reversing heart disease with oral estradiol in both men and women. Sharon's perfect example of not having any plaque at her age of 85. 85, yeah. Being on estradiol for the past 20 years.
And no other medication.
That's right.
Just the
no drugs, right? Yeah. All support.
Wonderful, yeah.
Yeah, and even though they come from compounding pharmacies, I don't call them I call them support for my aging process.
Right.
Because we need it.
Well, I ask you before I take supplements. There's all kinds of supplements on the market, and it could drive you crazy trying to keep up with it.
It's amazing how much marketing can go behind a bad product, and then everyone's buying it, and you're like, "Ugh, what a waste," Yeah. So I appreciate your trust in me. I really do. And for bringing Gary to us, we can help him now get a little more lively.
He's thrilled too. Yes.
Good. Yeah. And just for taking your time out to drive over here for us, Sharon. Thank you. I really am grateful.
Well, thank you for inviting me. I appreciate it.
I'm so glad you said yes. Thanks, Sharon. And thank you for listening to the Dr. Ramsey Show. If you have any questions, just send them in. Thank you so much and have a great rest of your day. Bye-bye.